Well, good evening, everybody. Doug Jenkins with the Findlay Hancock County Chamber of Commerce. We are live from our latest ribbon cutting, another one related to Blanchard Valley Health System, live from the expansion efforts at the Arms Family Cancer Care Center on Findlay's east side. I got all three of those C's in the correct order. I'm really happy about that. I'm with Amy and Adele. We're going to talk about what's been going on out here over the last year or so in expanded efforts for cancer services in Findlay and Hancock County. So let's start first with the genesis of the facility's been here for a little while now. What was the impetus of the expansion effort?
Yeah, so a few years ago, we really started to see our volumes increase. And, with that, we found that we needed additional space to let the staff do their work and to continue to care for the patients in our community. So, what started as sort of just a renovation and adding a little bit of space, our volumes really dictated that and told us that we needed to do a much larger project. So that's when we kicked this expansion off. And so it was about a 1.5 year long project. And, we are really excited that we're open for our patients and our community here. So it was a great project, a great collaborative effort from Blanchard Valley, the Blanchard Valley team, the community, our donors. I have to definitely take a moment to thank them for making this possible for us. And, Adele, I have to give her a lot of credit. There was a lot of logistics involved. We stayed open. We didn't close for even one day during this expansion. So, continue to be able to take care of our patients. And, moving into the future, it gives us the room to grow and to continue to take care of the community.
So, Adele, let's talk then about what this expands access to for residents in the area.
Oh, great. Thank you. At the Arms Family Cancer Care Center, we're able to provide comprehensive cancer care services to our local community and to a 7-county radius. We're very lucky. I'm going to echo what Amy just said. Our donors, our hardworking staff and associates, volunteers, and then the supportive community. They were rooting for us the whole time. But services, we have medical oncology services. We have expert providers who can treat all sorts of cancers from breast to lung, colon, gynecologic oncology cancers. We can provide infusion therapy services, whether it's just IV services or chemotherapy, biotherapy, targeted molecular therapies, or simple port care with certified nurses taking care of that. We do have 2 linear accelerators. So we are able to give radiation therapy treatments. We've got 2 wonderful radiation oncologists, and they have a team of radiation therapists, dosimetrists, physicists that help to give that service. We wouldn't be able to do any of that without our on-site pharmacy, our on-site lab services. And then to look at the patient as a whole picture, we have support services. So we have a registered dietitian, we have clinical trials, we have a financial oncology nurse navigator, we have other oncology navigators to help with resources. And then we work closely with nonprofits to provide all of those extra psychosocial needs.
That is an amazing degree of things. One, I'm hearing kids focus on STEM because it feels like there's a lot of STEM-related career fields right here with that. But 2, the importance of being able to offer this. There's a lot of communities that are the size of Findlay, but there aren't a lot of communities the size of Findlay that have access to resources like this at home. So you end up having to go to a Columbus, a Toledo, a Cleveland to get services like that. What does that mean for area residents, and what does it mean for you to be able to provide that type of service?
So our goal is to provide quality cancer care with using state-of-the-art technology here in our community close to home. So eliminating the need for our patients to travel on top of everything else that they're working through. So this expansion is helping us reach that goal. We were able to improve our access. So we have several new exam rooms. It prevents wait time in our lobbies. We have, as Adele said, a brand new newly renovated and expanded pharmacy and lab. So again, preventing delays and allowing patients to get their care a little bit faster when they're here. Just with those larger volumes, we want to be able to accommodate that. And so we also have more infusion bays so we can get people in a little faster to start their treatment. And then moving back to our radiation oncology, like Adele said, we have a very extensive state-of-the-art system, 2 TrueBeam linear accelerators and a brand new CT simulator. So, having all of that and that all came with this project really gives us the ability to give that expert cancer care right here in the community, and patients don't need to travel on top of everything. So
they're about to do tours here. I don't think they're going to let me fire up the linear accelerator. That doesn't sound like a wise use of anything. Obviously, this is means a lot to the health system. It means a lot to the community in terms of quality of life. But going back to just all of the different technicians you have to have, and the different doctors you have to have, and the specialties and everything, I really think you're also bringing in different professionals into the community to experience Findlay and Hancock County. And when we're able to bring people in like that, that contributes to quality of life around the area as well. It's just there's a ripple effect from a project like this that goes out well beyond just the walls here.
Yeah. And like Adele said, thanking the staff that provide this care, and with the growth, the staff grew. So that was part of what we also had to focus on with this project, was the space that they were doing their work in and making them efficient and close to their work. And we spent a lot of time making sure that they were going to be able to do their work well as we grew. So I don't know if you would have anything to add, but we have an excellent staff, and hopefully we've been able to make their work day a little easier. So
I have to agree 100%. It was all about the staff. They kept their humor, they kept their compassion, even though there were drills. There were all sorts of noises we couldn't explain happening at all times. They made sure that the patient was number one. So 100% the staff. Yeah.
So if someone is looking, so they need cancer services, what's the first step in getting in touch out here and learning more about what's offered?
Sure. So generally, your primary care provider can help make a connection. We have really good relationships with all of the area primary care and specialists, so that they can refer to us. But in addition, we also have a public email address, canceranswers@bvhealthsystem.org, and that can be accessed on our public-facing website. But if you have questions, you can send those, and actually Adele and I answer them, and we get them to the right people. So.
All right.
I have nothing to add. That was
it's all covered.
That was covered.
Well, I appreciate you both taking time, and I know it's a busy night tonight with the tours going on and the ribbon cutting and everything. Thank you for talking to us a little bit more about what's going on out here. It's really exciting to see what's happening in the future of Findlay and Hancock County, and this is just a big part of what's going on with that. So thank you for all that you do.
Thank you.
Thank you.
And that'll do it for today. We've got one more ribbon cutting coming up this week. Be sure to be following us on our social media channels for that. And you'll learn more about what's happening in the Findlay and Hancock County business community. For Amy and Adele, I'm Doug. Have a great evening, everyone.